What's up, pharmacy family? Coming at you today with a little bit of information regarding pain, both chronic pain, cancer pain, and neuropathy, which is a nerve pain that you can see anything from post-injury to post-shingles to post even cancer treatment that can happen, as well as people with diabetes tend to have or develop neuropathy over time. Several interesting articles and studies out there regarding pain. I know when you think of pain, you think first option in most cases is narcotics or opioids to treat pain. Yes, they're out there, but they're not always the best option because they do have a long list of side effects, as well as they are addictive, as well as they can be kind of literally a pain to get because you require a prescription, there's time limits and things like that. So what are some other options that you can do? Well, these articles basically talked about some non-prescription options. One of which, even though I realize it hurts, but exercise is very important when you deal with pain because your muscles and joints hurt. But when you get them moving, you actually increase blood flow to those areas, which can decrease inflammation. And the more that you do that, the more flexible and loose they become, so you have less inflammation and less pain. I realize that not everybody's going to go out and run a mile or climb 10 flights of stairs. However, there are little things that you can do just around the house to keep yourself moving to help with the pain, such as morning stretches, push-ups off the wall. If you're older and have weight limitations, you can take cans of corn or vegetables and just lift them over your head. You think, oh, that's not much, it's maybe a quarter of a pound. You're right, it's not much, but if you do it 50 times, let me know how your arms feel, because it does add up. Some of the other things that the articles talked about was some of the over-the-counter options you can use for pain. If you don't have any bleeding issues or no liver problems, you can take 1 extra strength Tylenol or acetaminophen with 2 ibuprofen over-the-counter strength, which are 200 milligrams. So you take those at the same time with food. And 2 of the studies actually show that it is about equivalent to 1 hydrocodone or 1 Vicodin. The benefits are you don't have the side effects, you don't have the dizziness, drowsiness, it is over the counter. Some of the setbacks are you do have to take them at the same time, so that's 3 pills at once or consecutively. And the other thing is it can upset your stomach, so make sure you take it with food. Some of the other supplements, not actually drugs you consider, that the articles did talk about was vitamin B12. Vitamin B12 is an essential vitamin for a lot of different things, but one of the things that it really plays a part in is neuropathy. So if you're having nerve pain, if you were to take vitamin B12 once a day orally, 1,000 micrograms is a general one, you can go up to 2,500 micrograms once a day, it helps with the deficiencies that can be caused by nerve pain, especially related to alcohol related nerve pain. If you've drank alcohol for a long period of time or you are an alcoholic, your body is going to be deficient in vitamin B12 and folic acid. It's very important that you continue to supplement that even if you've been sober. So vitamin B12, 1,000 micrograms plus 400 to 800 micrograms of folic acid a day, and that is also over the counter. But the studies did show that post shingles, diabetic neuropathy, and the alcohol related neuropathy did see results with the B12. It's something you can do over the counter without actually seeing your provider, but again, if it does not help you all the way, definitely talk to your provider about doing something else. More along the lines of chronic pain, the studies were showing that vitamin C, C as in cat, 500 milligrams once a day helped with the chronic pain. A lot of pain patients actually are deficient in vitamin C, which is an antioxidant. Cancer patients especially are low in vitamin C. So if you can take vitamin C orally 500 milligrams once a day, it will help. They showed that people taking narcotics or opioids that also took vitamin C actually had to take less of the opioid, and because of that they had less side effects because of the pain medication. So vitamin C is a good antioxidant to boost your immune system as well, so it's not a bad idea to take on that. They did use in the studies IV vitamin C, which you have to get from an infusion center, your provider, the hospital, but those actually showed results in rheumatoid patients for rheumatoid arthritis, which was very interesting. But again, that's not something available to you in the general public. Another thing to look at was vitamin D, as in dog. It has anti-inflammatory properties. It's another strong antioxidant which helps boost your immune system. I highly recommend at least 1,000 to 2,000 a day. And if you have an issue going on, bumping it up to 5,000. The majority of Americans don't get enough vitamin D in their diet or expose themselves out in the sun to get enough. Now, based on what your vitamin D level is how the response to the pain will occur. If your vitamin D is pretty good, you're probably not going to get much of a response to take additional vitamin D to decrease your pain. But if your levels are low, like I said, most Americans are, it will actually help with the anti-inflammatory or to decrease the inflammation associated with the pain. Like I said, I generally recommend 1,000 to 2,000 a day. You can go up if you have other issues. Talk to your provider. Don't do more than 5,000 a day. That's not good. The last thing that they talked about was migraine sufferers. Huge amount of migraine sufferers going on in the world today, not just the United States. Combination of lack of things in your diet, increased stress, increased or lack of exercise going on, as well as lack of hydration. I preach and preach hydration. With migraines, it's very important that you get enough fluids, mainly water, into your body to help prevent and ward off migraines. But one of the things that they showed is migraine sufferers, as well as fibromyalgia patients, had low levels of magnesium. They really didn't formulate that magnesium supplements actually helped because there's so many different magnesiums out there. You can buy magnesium citrate, magnesium oxide, magnesium carbonate, but it also is one of those things that did help a certain population. So it would not hurt for you to try magnesium. The one that mainly is over the counter that we see most of is magnesium oxide, 400 to 500 milligrams once a day. That does definitely help with cramps, muscle cramps, things like that you can experience on a daily basis, but do take it at night, because one of the pleasant side effects of it is it can make you drowsy. So I recommend it a lot for sleep. So that magnesium, even though it has mixed results on fibromyalgia and migraines, it won't be a bad thing to take, but stick around 400 to 500. Do not go above the 500 milligram mark because there can be some issues with the heart. If you are a heart patient, talk to your provider before you start any magnesium. I hope some of these tips will help you out if you're a pain sufferer. Definitely, if you have any questions, talk to your pharmacist or provider about starting anything new. But everything that I've mentioned, except for the IV, is available over the counter, and most of them are things that we are lacking in our diet in the country today. If this video helps you, or if you're interested in learning more about disease states, just hit that subscribe button down below to follow us for more helpful tips.